Roll call, Madam Secretary.
Member Coutier? Member Eglai? Member El Shantiri?
Present.
Member Gower?
Here.
Member Kapoor?
Present.
Member Kavanagh?
Present.
Member Lakin?
Présent.
Member Menard?
Present.
Membre Pinel?
Présente.
Membre Poirier?
Présente.
Member Tilley?
Present.
You have quorum, Mr. Clerk.
Thank you. We have no regrets. Declarations of pecuniary interest arising, including those originally arising from prior meetings. I have none. Are there any others? Seeing none. Communications. The board will receive the communications as noted in the agenda. Member Poirier, will you please move the motion to introduce reports?
Be it resolved that the reports titled Election of an Interim Chair and Interim Vice Chair, State of Ottawa's Health 2018, an update, and Accreditation 2020 be received and considered.
Carried. Thank you. First item on the agenda is the election of an interim chair and an interim vice chair. The recommendation reads that the Board of Health for the City of Ottawa Health Unit elect an interim chair and an interim vice chair to be confirmed at the first meeting of 2019 as required by the Health Protection and Promotion Act. Now, in accordance with Section 5 of the Board's procedure bylaw, I will be the presiding officer for this portion of the meeting. As noted in the report before you, the Board is currently without an elected chair. Further, as required under subsection 57(2) of the Health Protection and Promotion Act, the position of chair and vice chair are to be confirmed at the first meeting of the Board in each calendar year. Finally, given that the City Council is expected to appoint a new citizen members to the Board of Health early in the new year. Accordingly, the Board is currently being asked to appoint an interim chair to be confirmed at the first meeting of the Board of Health in 2019. The Board will be asked to elect a chair for the remainder of the term at its first meeting following the appointment of the new city members. In the event that more than one member is nominated for the position of interim chair, a vote will be required. Member Poirier, do you have something?
I move that Member Eglai be nominated for the position of interim chair for the Board of Health for the City of Ottawa Health Unit to be confirmed at the first meeting of the Board of Health in 2019 pursuant to Section 57, subsection 2 of the Health Protection and Promotion Act.
Member Eglai, do you accept the nomination? I call for any additional nominations. I call for any additional nominations a second time. I call for any additional nominations a third and final time. Given there are no initial nominations, Member Poirier, would you please read the motion to close nominations for the position of interim chair and the motion to appoint the interim chair?
Yes, I move that the nominations for the position of interim chair be closed.
Is that carried? Member Poirier?
I move that the Board of Health appoint Member Eglai as interim chair for the Board of Health for the City of Ottawa Health Unit to be confirmed at the first meeting of the Board of Health in 2019 pursuant to Section 57, subsection 2 of the Health Protection and Promotion Act.
Is that motion carried? Thank you all. I congratulate you, Member Eglai, on being appointed as the interim chair and invite you to take over the chairing of the meeting of the Ottawa Public Health Board.
Thank you very much. Similar to the process we just followed for the appointment of interim chair, I'll now request nominations for the position of interim vice chair, excuse me, to be confirmed at the first meeting of the Board of Health in 2019. In the event that more than one member is nominated, a vote will be called. I'll now call upon Member Cloutier.
Merci, Monsieur le Président, and congratulations on your appointment. I move that Member Poirier be nominated for the position of Interim Vice Chair for the Board of Health for the City of Ottawa Health Unit to be confirmed at the first meeting of the Board of Health in 2019 pursuant to Section 57, subsection 2 of the Health Protection and Promotions Act.
Member Poirier, do you accept the nomination?
Thank you, I accept.
Given there are no additional, I call for any additional nominations. Given there are no additional nominations, Member Cloutier, would you, I call for additional nominations, and I call for additional nominations. Given that there are no additional nominations, Member Cloutier, would you please read the motion to close the nominations for the position of Interim Vice Chair and the motion to appoint the Interim Vice Chair?
Yes, sir. I move that the nominations for the position of Interim Vice Chair be closed.
Is carried, thank you. Motion to, is that motion? Yes. So can you move the motion now?
And I move that the Board of Health appoint Member Poirier as Interim Vice Chair for the Board of Health for the City of Ottawa Health Unit to be confirmed at the first meeting of the Board of Health in 2019 pursuant to Section 57, subsection 2 of the Health Protection and Promotions Act.
Is that motion carried?
Carried.
Thank you. Congratulations, Member Poirier, on being appointed as the Interim Vice Chair.
Thank you.
Before we jump into the agenda for the meeting, I just wanted to say a few quick comments. First of all, I wanted to thank former Chair Shad Qaudry for his 4 years of hard work. He led the board, along with Dr. Etches, through some very difficult files, from supervised injection sites to the introduction of the casino. And so I'd just like to thank him for his good work in that regard. And secondly, I'd like to thank everybody for allowing me to take on the role of chair. Over the last few days, some people have wondered and come up to me and said, well, you've chaired Transportation Committee for the last 6 years. Why did you suddenly want to chair the Board of Health? And my answer to them is I've spent the last 6 years working on improving the city's physical infrastructure. And while I believe this to be an important and necessary work, equally necessary and equally important, I believe, is the growth and nurturing of our social infrastructure. Public health is a foundational piece, I believe, of the social infrastructure of our city. And in that regard, I just see a continuation of the work that I've been doing, just taking on a new piece of infrastructure. And I'm very pleased to be working with a team that I know are very dedicated and passionate professionals. And I look forward to 4 years of solid, progressive work on the public health file as we go forward. So, on to the agenda then. We first have a report, the State of Ottawa's Health Update 2018, and there is a presentation, I believe, for that. So I will hold that. Next is the accreditation for 2020, and there's no presentation for that particular one, so we're simply asked to receive that report for information unless anybody wishes to hold it for questions. Received? Thank you. So we will go back then to the State of Ottawa's Health 2018, an update for the presentation.
So I'm going to introduce this report as two of the key people behind the work come forward to be part of the presentation. So you have met probably Amira Ali previously, our senior epidemiologist, and also joining her is Dara Friedman, who is also on the epidemiology team. So I think we'll begin by recognizing, because this is our first meeting, I just want to go back to the basics of what public health does. And I think it's generally accepted actually around the world that there are 5 things that public health systems do, public health organizations. First of all, we report on the health status of the population, and we do surveillance. We also protect health, we promote health, we prevent disease and injury, and we prepare for emergencies, and we respond to emergencies. So there are 5 things, and it starts, in my mind, with that health assessment, the health of our city, gathering data. In fact, you could argue that the roots of public health go back centuries. We're counting the number of people who died and looking at the reasons for why they died led to a science of public health. And it is that foundation, this measuring the health of our society, the risk factors, the strengths of our society, that informs all of our work. So, le présent rapport offre un portrait général de la santé de la population d'Ottawa et permet à Santé publique Ottawa de prendre des décisions éclairées au sujet des politiques, programmes et services de santé. The timing of presenting this information is also important for informing our strategic plan. So I look forward to working with you on that strategic plan that will guide our actions for the next 4 years. The other way we use this kind of health information is to inform our community and the partners that we work with across Ottawa, other healthcare providers, and others beyond the healthcare system, because we know that we have a unique role. We are the only organization that puts together the information like you're seeing tonight that crosses all ages, all kinds of health issues, including our environment and how people transport themselves around our city. All of these things are relevant to health, and many of the actors that can shape the health of our city are outside of the public health sector, and so we share information with them to also inform how other policies are shaped to protect health. In 2014, that was the last time we did a health status report that covered so many subjects. We had a document, and I think what is positive, progression in the way we do things, I could look at the next slide, is that this report is mostly online. And so it will be updated more easily. We'll have, in today's report, the latest information, but more data becomes available over time, and so we can update our information easily online. And besides this kind of health status report about the whole population's health, we do more specific health status reports on specific subjects from time to time. So a good example of that, I think, where we were leaders in the province, actually in the country, for public health, was a look in depth at mental health status in our community. And so all these reports are online, ottawapublichealth.ca, ottawasantépublique.ca, where there are reports listed. So with that introduction, I will turn it over to Dara and Amira to go through some of the highlights.
Thank you, Vera, and through you, the Chair. Ottawa's population grew to 996,651 people in 2017. That's a 6% growth since the 2011 census. 15% of the population is 65 and older. Ottawa is also increasingly diverse, with 1 in 4 residents as a visible minority. 10% of residents speak French at home, and 11% speak a language other than English or French at home. There are generally high levels of education, with 3 in 4 having post-secondary education. However, 13% of Ottawa residents are living in low-income or substandard housing. Generally, 2 in 3 Ottawa residents report excellent or very good health, which is a strong predictor of morbidity and mortality. Ottawa has lower rates of death and higher life expectancy than the provincial average. Since 1986, Ottawa has consistently had lower rates of death, on average, than in Ontario. There were approximately 5,400 deaths in Ottawa in 2012, the most current year of data available. The life expectancy for Ottawa women has remained stable and is estimated as 85.2 years in the 2014 to 16. For Ottawa men, life expectancy increased from 81.3 years in 2010 to 12 to 81.9 in 2014 to 16. The leading causes of premature, which means that death before the age of 75, and preventable death include injuries, such as falls, suicide, transport collisions, and overdose or poisoning, cancer, and cardiovascular disease. These have remained unchanged from 2010 to 2012. For health benefits, Physical activity guidelines recommend children and youth accumulate 60 minutes per day of moderate to vigorous physical activity. 1 in 5 Ottawa youth reported that they meet these guidelines. Screen time recommendations for youth are 2 hours or less of screen time per day. 59% of youth reported that they exceeded those screen time guidelines. Regarding sleep, the guidelines for youth are 9 to 11 hours per night for ages 5 to 13, and 8 to 10 hours per night for ages 14 to 17. 56% of youth do not meet those guidelines. For adults, 7 to 9 hours per night for ages 18 to 64, that's the guideline, and 7 to 8 hours per night for ages 65 and older. 55% of adults meet these sleep guidelines. In terms of nutrition, 1 in 3 residents eat the recommended 5 or more times of fruits and vegetables per day. And 7% of households reported being food insecure in 2013-14. When we talk about leading causes, we're referring to the leading causes of emergency room visits, hospitalizations, and death. In 2017, Ottawa residents made 338,353 visits to the emergency department. Injuries continued to be the leading causes of emergency department visits with 92,000 visits. In 2017, Ottawa residents had over 70,000 hospitalizations. Since 2016 and continuing on into 2017, mental and behavioral conditions with approximately 7,100 hospitalizations became the second leading cause of hospitalization. In 2012, the leading cause of death were heart disease, dementia, and lung cancer. As already mentioned in the previous slide, injuries are one of the leading causes of premature death and disability in Ottawa. In 2012, there were over 300 injury-related deaths in Ottawa. The top 3 causes of injury death were falls, as you can see from this graph, falls, suicide, and unintentional poisonings and overdoses. Falls became the leading cause of injury-related death since 2008, particularly among people 80 years of age and older. The number and rate of death related to unintentional poisonings and drug overdose rose from 2008 to 2012.
Thank you. OPH released a detailed report on the mental health of Ottawa residents in June 2018. Here are some of the findings. 70% of residents reported very good or excellent mental health. However, other residents are experiencing poor mental health or are living with mental health conditions or addictions. The rates of emergency department visits and hospitalizations for mental health and addictions increased by 45% over the last 10 years. Most recently, there were more than 17,000 emergency department visits and 7,000 hospitalizations. This increase is being driven by a sharp increase among youth and young adults. Certain groups impacted by socioeconomic inequities are more likely to experience poor mental health and mental illness. Residents living in less advantaged neighborhoods had more than twice the rate of emergency department visits for mental health conditions and addictions compared to those living in more advantaged neighborhoods. There are an average of 80 deaths by suicide every year in Ottawa. Also, the rate of self-harm emergency department visits has been increasing. Finally, 1 in 9 grades 7 to 12 students seriously considered suicide in the past year, and 60% of these students reported that they had wanted to talk to someone but didn't know where to turn. Regarding substance use, 15% of adults smoke tobacco, down from 18% 10 years ago. 15% of adults use cannabis. 36% of these adults use it once a week or more, and 44% use it less than once a month. Canada's low-risk drinking guidelines recommend that men drink no more than 15 alcoholic drinks per week, and women drink no more than 10 drinks. 1 in 5 Ottawa adults report drinking in excess of these weekly guidelines. Also, 1 in 5 adults are heavy drinkers, meaning that they binge drink at least once a month. Opioid overdose deaths have increased markedly. from 34 in 2015 to 64 in 2017. The opioid overdose mortality rate in 2017 was highest in 45 to 64-year-olds. However, the highest rates of emergency department visits due to unintentional opioid overdose are seen in young adults. Shifting now to infectious diseases, rates of some sexually transmitted infections continue to climb. Gonorrhea, infectious syphilis, and chlamydia, taken together, have increased over 50% in the past 5 years. Ottawa has between 87 and 98% immunization coverage among 7-year-olds for vaccine-preventable diseases covered under ISPA, the Immunization School Pupils Act. Ottawa surpasses the national goal of 95% coverage for rubella and meningococcal C conjugate. We approach the goal for measles and mumps, and we are below the goal for diphtheria, tetanus, polio, and pertussis. There are gaps in Ottawa residents' understanding of the prevention of emerging vector-borne diseases such as Lyme disease. 62% of adults who were aware that one could get Lyme disease from a tick actually protected themselves from ticks. Finally, especially for sexually transmitted infections and for some respiratory infections like tuberculosis and invasive group A strep, some populations are more affected than others. These include people who are marginally housed, people who use drugs, gay, bisexual, and other men who have sex with men, and people from countries where these diseases are common. This is the last data slide about reproductive health and early years. In 2017, just over 9,500 babies were born to Ottawa women, down from nearly 10,000 live births in 2013. Births among teenagers are down to 105 births in 2017 from 158 in 2013. Approximately 90% of mothers fed their babies breast milk after birth, and 70% were feeding breast milk at 6 months. And finally, 1 in 4 senior kindergarten children were considered to be vulnerable in one or more of the areas important for healthy development, including physical health and well-being, emotional maturity, social competence, language and cognitive development, and communication skills and general knowledge.
So Chair, I'll take it back just to conclude. You've heard a lot of numbers. There's even more on our website. I think just to highlight at the highest level, this kind of information leads us to think about how prevention is most important in early years. We see room to start to address mental health issues in the early years when we see data like 1/4 of school children are not ready to reach school or to perform in school on their emotional maturity scores. We know that chronic disease prevention is going to continue to be important given the burden of disease in our population, and considering that across the lifespan right through older age. Fostering mental health, we can see in a number of measures, it's a growing challenge for the health of our population, again, with significant opportunities to intervene when it comes to young people's mental health. And still, infectious diseases continue to be putting our community at risk. And reducing injuries and drug overdose is not unlinked from an aging population. The falls are among people most, the significant risk of death is for people over 80, as well as drug use and drug overdose is a challenge that we link to mental health as well. So that's the high-level summary I would provide, as well as recognizing that across these issues, there are populations at greater risk, and very often it is people who have the least advantage when it comes to income. And so again, Ottawa Public Health will continue to use this information to inform our programs and services, to evaluate how we're doing over time, to influence our partners' programs and policies, and we look forward to being able to go into more depth with what this means to you and what you think we need to focus on in our next strategic plan. Your questions right now are also welcome. We have, again, people at the table, Dara and Amira, who know a lot about this information, and we're happy to address any questions now.
Thank you very much. I'm going to start off with the questions, and Councillor El Shantiri has indicated he has some questions as well. One of the, or two of the statistics, 1 in 5 youth are not meeting the physical, or only 1 in 5 youth are meeting the physical activity guidelines, but 59% of youth seem to be exceeding the screen time. So can we make a correlation? Is that the kids that are not exercising or not meeting, are they the ones in front of the screens, or are there other intervening factors, or is that just too linear?
Through you, Chair. We have not made this correlation, but it is something that we could look at, and I can get back to you about that.
And I guess the question that follows from that is, do we have any programs in place, any outreach to pull kids away from the screens?
Hi, Councillor. Thanks for the question. I think we definitely are working with our school board partners in terms of developing greater information to the schools. So we work with elementary schools to be promoting daily physical activity. One of the big elements that we're actually starting to promote a lot more is outdoor play, because one of the things that we're finding is really trying to promote that what we would call is unstructured play, is so not that very where people are needing to join sports or whatnot. So trying to create an environment where parents feel a lot more comfortable with encouraging their kids to be outside and not having that stranger danger and whatnot, and making sure that they're feeling comfortable at playground. So those are the elements that we're working on. In terms of the screen time, we also recently have been working with our Parks and Rec partners in terms of Healthy Kids Community Challenge, which has been provincial funding for the last 3 years. And screen time was one of the themes over the year that we worked with them, and trying to reduce that and telling kids the risks of the screen time. But we also acknowledge that this is one of the biggest probably challenges that we face as adults, to try to reduce screen time for kids.
Just one more quick question before we move on to the other. You gave us a breakdown in terms of adults for cannabis use, for overconsumption of alcohol. It's broken down by adults. So I guess my first question is, what is an adult? Is that simply 18 plus? And the second question is, do we further, I didn't see it in the report, but do we further break the adult group down by gender?
Through you, Chair, thanks for your question. So for adults, yes, it's 18 plus. This is based on survey data that surveys residents.
So that could be anyone from 18 to 85.
That's right.
Okay.
That's right. But we do look by age group. So we don't have. So for cannabis, we know that it's highest among men and also among young adults, so 19 to 24-year-olds.
Okay. The reason I asked the question is whether we need to look at tailoring our education, our outreach to particular genders, to particular age groups, rather than a blanket campaign, that we need to have a number of sub-campaigns, if that makes sense.
Yes, Chair, that's exactly the direction our team is going in terms of with cannabis. We've gotten some general messaging out there, and now we know we need to reach specific target populations with different messaging based on their different patterns of use, based on different ages and demographics. So that's what we expect to evolve over this year.
Okay, thank you, and thank you for sharing. You sent the memo out earlier today to all the council members with a whole lot of information and links to various programs on the cannabis issue. So thank you for that. Councillor El Shantiri, or Member El Shantiri.
First of all, thank you, Mr. Chair, and thanks to the staff for the report. What I find it a little bit interesting is we don't have any comparison with any other municipality of our size. So if we want to know how well we do or how not so well we do, is there a comparison? Is there best practice been adopted or measurement with other municipality of our size available?
Through you, Chair. So for some of these measures, there are available peer groups or comparators, other peer health units that we have access to.
but I know you have access to, but how is it possible for us to see that in the future when we're presenting something, perhaps when you have especially when we talk with numbers, those are very important, especially for some of us who wants to see if the cannabis legalization is going to increase, decrease, where's those numbers going to change. I think it's important for us to see I think Ontario used to receive information and they have the measurement with among the province where we are, like, you know, in a municipality the size of ours, where our number fit, how well we do. I think it'll be helpful to see those in the future, so just for comparison, if it's possible.
So just to one, through you, Chair. So for most of these measures, we have compared ourselves to Ontario, but I take your point about comparing to other municipalities.
Okay, thank you, Mr. Chair.
Thank you. Member Kapoor.
Thank you. Thanks for this. Building on the idea of that you, Chair, had raised, is the idea of trying to figure out what the upcoming challenges are going to be. And Chair, you mentioned cannabis. The other ones I see here are the explosion in youth using e-cigarettes and vaping, which we don't see here because of the limitations of the databases we used, and the upcoming expansion of access to alcohol. As we saw very clearly with the report when we discussed the casino and gambling, access to these items increases the problematic use of these items. So we need to be ready to deal with that. So I'm just, in terms of going where the puck is going to be, I'd flag those issues, the increased access to alcohol as well as to cannabis. And we may, and the board and the unit itself may need to focus on youth use of e-cigs and vaping as well as water pipes, because it seems that the provincial and national data sources that we're using are being too slow in recognizing those. The other one I wanted to I was going to flag for future follow-up is the increase in sexually transmitted infections. It's problematic. It's when last time I saw comparators, I believe Ottawa was higher than the Ontario, less Ottawa. I don't know about other similar sized cities in the country, but seeing that rising continue is something worrisome.
Through you, Chair. So I'll hand it over, a few things to add. On the vaping and the alcohol use, absolutely, those are subjects. When we talk about focusing on substance use, we include that. The burden of illness due to alcohol is significant, and vaping is something we're looking at among youth. We do have local data sources that we can use. So for those who are new to the board, we have rapid risk factor surveys that we can implement new questions within 3 months turnaround. So, you know, to a limited degree, we can't ask too many questions in any one survey, but there is some adaptability that we can use there to explore emerging issues. And the other thing you were just asking about, STIs, exactly. So interesting information in the report here about how there is greater uptake of testing in our young population in Ottawa. So Ottawans get tested more often than their counterparts across Ontario. It appears that's good, and it may also be why we see greater numbers of sexually transmitted infection that are being diagnosed. So we have focused on campaigns that are about getting tested locally, and it is another example of where we need to tailor the messaging to particular audiences that have different risks. And so our team has a sexual health strategy that looks at that, at focusing on the populations that are at greatest risk, and that's continuing to be their priority.
Through your chair, I can add to that regarding the STIs. There is information on the website regarding comparators with Ontario. We are higher than the rest of Ontario for some STIs, but not for all. And you can see that there in the report. And regarding e-cigarettes and other issues that are sort of more recent, in addition to the Rufus data source that Dr. Etches mentioned, we also have OSDIS, which is the Ontario Student Drug Use and Health Survey, and we have an Ottawa sample for that. And so you'll find also on the report a section on e-cigarette use in youth.
Next up is Member Kavanaugh.
Thank you very much, and I appreciate the questions from Member Kapoor. I was going to ask, just to follow up on that, was the stats on marijuana versus tobacco. They were in separate categories, and strikes me there might be overlap, and I don't know, because sometimes there's a correlation there, and I don't know if we have that kind of information related to the tobacco smokers versus marijuana, because with the legalization of marijuana, I'm concerned that they actually may turn to tobacco as well, possibly, but I just wonder how they overlap and if we track that at all.
We haven't looked at that specifically in the report yet, but that is something certainly we could do. That's an interesting point.
Okay, thank you. I have another question. I'm wearing my other hat right now because I am the liaison on women's issues and gender equity, and I would like to know how much gender-based analysis we've done in public health. There strikes me as there's a lot of issues here for women and girls, and it's an opportunity for us as a municipality to tailor programs for women and girls that could particularly help. So I don't know what is available, but I'm just asking a broad question on that because it is a very broad subject, taking in half the population of the city, and if that's possible at all, or if it's been considered.
So if by gender, are you talking about males, females, or are you talking about, okay, so for the most part, we break down most of our data by sex, by male and female. So you'll see that in the detailed.
Yes, I see that.
pages.
For example, like physical activity for girls versus boys, you can see
Right.
that there's a difference. But I guess the next thing is, where do we do with that? Do we tailor programs to, for women, girls in that respect? I mean, this is part of what I see my mandate in terms of looking at what municipal programs we have and how we can work towards making them better for women, girls. Is that something that we look at?
So thank you for the question. I think that this data points to the need to do that in terms of there are different issues. It comes up at different causes of death, different risk factors, and our team does use this information to plan their activities, and I know we have had programs that are specifically for women, where that's been indicated that there's a specific need. I'm sure we could do more, and I appreciate your perspective that that's something else we can bring.
Yeah, well, I think we should advertise. It's not meant to be completely critical. It's also, we should gather up what we have been doing. I think that would be positive as well, because I'd like to see it all together based on that subject, because it is about the programs you run. Just one more question, and it's about air quality. Maybe I missed it, but do we measure it at all and look at the effects of it?
So through you, Chair, so we have not presented environmental factors in this report, but in terms of air quality, yes, we do have a measure for air quality.
Okay. All right, thank you. I'd be interested in that.
Thank you very much. Member Poirier.
Thank you, Mr. Chair. I wanted to pick up on my colleague's comments of the alarming increase in STI. I guess the one other piece that would be interesting to see is whether there is a correlation between that rise and the use of cannabis and other substances, because I bet you they're related. So just throwing that out there for future analysis.
Thank you. And are there comments from staff on that? Yes, no? Don't have to.
Through you, Chair. Thank you for that question. So that's something that we do look at. So for every case of an STI in an individual, we do follow up and we collect information about risk factors for that individual. And one of them is whether they were under the influence of drugs or alcohol. So that is something that we do look at.
So that helps us orient the education too. Yeah, thanks.
Thank you. And Member Menard.
Thanks very much, Chair. Thank you very much for the presentation. I come from the school board world, as does Member Kavanaugh, and I think public health does a great job of integrating in our schools. There's a real partnership there, which is essential. One of the reports that came out, or statistics that came out, it was about a year ago, I think it was in the public, was the number of students contemplating suicide, and it was a shocking figure. I think you had 1 in 9 out there. I thought it was 1 in 7, but when the report came out, but if it's 1 in 9, it's 1 in 9. It's still too high. I guess, what concrete steps have been taken since that figure was released or the report was out about a year ago to improve, I guess, mental health or interaction with our students that may be in this state of mind, which is a lot of students. You know, it's 70,000 alone in the OCDSB, so that's, you can do the math there. But what steps have we taken to help mitigate that?
I can start, and then I could invite the manager who works with schools and health promotion, mental health, to comment. So one thing we know that was really concerning about that figure was that youth didn't know also where to go for help. And so that's a big part of it. Also is, first of all, addressing underlying risk factors for mental challenges, mental health challenges, feeling suicidal, and then helping link people to support. So there are a number of things we do. We provide a Safe Talk program, which is training to help people understand how to recognize the signs that someone is thinking of suicide, and how it is quite simple to intervene and link somebody to care. So that is a program that we continue to provide across the city, actually for city employees as well as partners in the community. We also are working with youth to decrease stigma and to make it clear that youth can be supports to youth in schools when it comes to mental health. And so one of the things we did this year was Have Your Say kind of video campaign where youth created their own minute of what they wanted to say about mental health and reaching out for help. And I watched those videos being shown, the winners on the big screen. You know, it was fabulous to see youth reaching out and in a way that made sense to their peers, describing you know, that this is something that there's help available and to help each other. So that's a video campaign that was then used on social media and is continuing. So we plan to keep building on that and helping the message spread in the environments that youth are using to share messages. Is there anything else you wanted to address, Jillian Connolly?
The only other two elements is we have a program in elementary schools, and it used to be in junior high, and we've moved it down. It's called Healthy Transitions, and it works directly with the teachers and the students to develop their resiliency, because as Vera was mentioning, we're really trying to also address what is that root causes of people having some of those thought processes. And the other element, we do contribute to funding counselors, substance use and mental health counselors in the schools. So that's also trying to get better linkages for the kids to actually know that those are in the schools, because I think one of the things is trying to meet kids where they're at. So if they're having some of those thoughts, getting them to those counselors. That's the other two pieces.
Thanks very much, Chair.
Thank you. Are there any other members who have any questions? Absolutely.
Thank you, Mr. Chair. I'm encouraged by the questions tabled to the staff, and by the way, thank you, staff, another very informative report. I'm encouraged by the interest in a number of particular metrics, whether it's cannabis use, STIs, gender inequities, and health. And you'll forgive me if this is a comment, not a question, Mr. Chair, but the comment is that as members around the table recognize that the metrics are in fact changeable, that our objective is to try to improve the metrics that we're hearing about. Health is a complex outcome, and one of the invitations I would like to extend for non-public members, for councillors, is to think of health as a metric or an outcome that's influenced not only by what OPH does, but what goes on at other committees, whether it's transportation, development. One needs to simply look at whether poorly lit places lends to more cannabis use in public spaces, or whether not having play spaces in dense areas leads to more screen time and more sedentary behavior. I'm hoping that for those members that sit on other committees, that health will be part of their focus in influencing and adding to what OPH does. And I'm encouraged by the questions, because clearly folks have an interest in improving the numbers through a variety of means.
Okay, you're right, it wasn't a question, but it was a very helpful comment. And I think over the next 4 years, we want to build some of those bridges between this board and the other boards and committees. So I appreciate that. Are there any other members that might have a question? Okay, so can we receive this report for information then? Okay, thank you. I'm going to turn to Vice Chair Poirier then for a motion to adopt reports.
Thank you, Mr. Chair. Be it resolved that the reports titled Election of an Interim Chair and Interim Vice Chair, State of Ottawa's Health 2018 and Update, and Accreditation 2020 be received and adopted.
Carried? Okay. Are there any motions requiring suspension of the rules? Okay, thank you. Are there any notices of motion for consideration at a subsequent meeting? Okay, Vice Chair Poirier, the confirmation bylaw motion, please.
Be it resolved that confirmation bylaw number 2018-7, a bylaw of the Board of Health for the City of Ottawa Health Unit to confirm the proceedings of the Ottawa Board of Health at its meeting of December 17th, 2018 be read and passed.
Thank you. Before we adjourn, I just quickly, I was remiss earlier on to thank the new members for stepping up and agreeing to be on the board. Much appreciated. And for the veterans, I hope you help us through the first few meetings as we get acquainted with the subject matter, so I appreciate that. And our next meeting is going to be February the 4th, 2019. Adjournment? Oh, sorry. Yes, we have to adopt the motion. Okay, thank you for that. Adjournment? Okay, thank you. Everybody have a Merry Christmas and a Happy New Year.